With us this morning for Today's Health is Randy Vawdrey from Physicians Immediate Care, and we are talking the latest and greatest that has been going in research that has been going on into the most important meal of the day, I guess. So first off, what is new research saying into breakfast?
Okay, so Dr. Willie, about 10 years ago when I met him, told me if I wanted to improve my health, I had to eat breakfast like a king, lunch like a prince, and dinner like a pauper.
Okay, so tear it back.
Tear it back. And this year, there's been 2 studies, one in the Journal of Circulation, that says if you skip breakfast, you're more likely to suffer from the complications of cardiovascular disease.
Right.
The second study was released in the International Journal of Obesity, and it said not only should you eat breakfast, but carb loading, or increasing the number of carbohydrates that a person eats in the morning, will reduce the risk of metabolic syndrome.
Okay.
Or in other words, it'll enhance a person's metabolism and reduce the risks of diabetes.
Really? So I guess, how do you figure out, like, there's a lot of different research out there in breakfast. How do you figure out which one is the correct one? I just did a Google search this morning and found breakfast that said a number of different things. Don't do this for weight loss, don't do this, do this, do that. How do you figure out which one is the right one, I guess?
Well, that can be a little bit complicated because some people are already diabetic, and some people are taking medicines for diabetes, and other people say, I can't eat breakfast, I feel nauseated in the morning. The key is that we understand that our metabolism is primed first thing in the morning to eat. Okay. And our metabolism is going to sleep at night, which is when most of the world has their biggest meal of the day. Right. And so it can be a little bit tricky trying to figure out how much to eat and what are the right foods to eat and so forth. But the key here is that a person should have the majority of their nutrients, when you're talking about the size of a meal, at breakfast time.
Okay. Is there like specific foods you need to be eating during this time, or just kind of that whole king, prince, pauper step plan? You know,
if all a person has is carbohydrates in the morning, oftentimes it stimulates their hunger, so they might feel hungrier later on during the day. And we typically are low-carb guys. We we encourage people to have a lower carbohydrate meal during the day. So the key to this would be that when you have breakfast, that you don't just have straight carbohydrates, but you have some protein, some carbohydrates, and fats.
A little balance.
Yeah, a nice balance. You're going to feel full for longer periods during the day. You're going to have energy level that increases during the day, and it generally helps people wake up first thing in the morning, right?
Okay. So it goes beyond just the metabolism, the health effects. You actually feel that much better.
That's correct. And I wanted to add one other thing, that, you know, Dr. Willie has really been preaching this for about the 10 years that I've known him. He wrote his first book in 1998, and this was one of the hallmarks of his book. And I think it's a real shout out to Dr. Willie for the research that he's done. He's really spent his life researching health and trying to help people attain health. And together with that, I wanted to give a big thanks to Pocatello for voting physicians, and Dr. Willie is one of the top medical practices and providers in Pocatello.
Nice. Congratulations.
So we appreciate that very much.
All right, well, thank you very much for stopping by this morning.